Hi, my name is Lauren Bell. I'm a PA student here at Damon, and I hear you're interested in quitting smoking.
Yes, I am.
That's awesome. Are there any specific therapies that you were interested in trying?
I had heard of a thing called Chantix. Would you be able to tell me what that is?
Yeah, so Chantix is going to be a pill. You are going to take it twice a day, and you're going to start taking the pill 1 week before you plan on quitting smoking, so it has time to kind of work in your system. And you're going to ideally take it for about 12 weeks, but if you still feel that you need it after the 12 weeks, you can use it for longer.
Can you tell me how does Chantix work?
Yeah, so Chantix is going to work on your nicotinic receptors. It's called a nicotinic receptor agonist. So nicotine is one of the ingredients in cigarettes that cause it to be so addictive. So this drug is kind of going to do the same thing to give you that same feeling of the nicotine without all the harmful chemicals of cigarettes. And it also stimulates the receptors at a lower level than the cigarettes, so this can kind of help you to eventually not be reliant on nicotine in the future.
Okay, and how effective is Chantix?
So Chantix is actually currently the most effective method for smoking with a success rate of up to 75%.
And are there any benefits to taking Chantix?
Yeah, so Chantix you only have to take twice a day compared to if you think about the throat lozenges or the gum that you're taking multiple times a day, so this is a little easier to be compliant with. It's the highest efficacy, so this is probably one of your best chances at being successful at quitting smoking. And you're not going to have the withdrawal symptoms of nicotine where if you were to kind of quit cold turkey with smoking, and this can also help with your reducing your nicotine cravings.
Okay, and are there any risks or side effects with taking Chantix?
There are some. Overall, it's very well tolerated and very safe, but some patients do report palpitations. That's kind of because you're giving yourself kind of like nicotine. And patients also report vivid dreams or nightmares. If not taken with food, some patients have nausea or just like kind of some GI complications like gassy or diarrhea or constipation. And some patients also report some like neuropsych symptoms.
Are there any reasons like that I would not be able to take this drug?
There are a couple. So if you have a history of renal failure or like severe renal impairment, we're going to want to talk about a different method. If you're currently pregnant or breastfeeding, which I don't think you are.
I'm not.
Okay. And then adolescence, which once again doesn't apply to you. And if you're being treated for any emergent neuropsych symptoms.
Okay, and how much does the Chantix cost?
So this is a little bit of a more expensive option. It's about $16 for 2 tablets. So that's about $16 a day.
Okay, well, thank you very much. And I'm also interested in learning about the Nicoderm patch. Can you tell me what that is?
Yeah, so the Nicoderm patch it's kind of like a Band-Aid, but it's going to be clear and it's even smaller than a Band-Aid. You're going to place it on your skin once a day. You can kind of put it wherever you want. It's just going to get absorbed into your skin, so the location doesn't really matter. There's 2 different doses, and that's going to depend on how many cigarettes you smoke at baseline. So if you currently smoke more than 10 cigarettes a day, we're going to start you on the higher dose, which is going to be 21 milligrams. And if you smoke less than 10 cigarettes a day, we're going to start you on the lower dose, which is 14 milligrams. And like I said, the patch is very small and it's easy to hide under clothing.
And how does the patch work?
So this is going to be kind of similar to the Chantix. The patch is going to stimulate the nicotinic receptors, the same receptors we talked about earlier, and that's going to cause a release of dopamine. You're going to put the patch on at the beginning of the day, leave it on all day, and you're going to use it for about 8 to 10 weeks. And then if you feel comfortable, our goal is to eventually discontinue the patch, but it can be worn longer than the 8 to 10 weeks if needed. At the end of the day, you're going to throw out the patch and you're going to put a new one on for the next day.
Okay, and how effective is the patch?
So this is a little less effective. There's about a 50 to 60% success rate. So still more successful than just quitting cold turkey, but a little less than the Chantix option.
And what are the benefits of a Nicoderm patch?
It's easy to remember because you're only doing it 1 time a day compared to Chantix, which is 2 times a day. Or if we talk about the gum or the lozenge, which is like multiple times throughout the day. It's very subtle, so it's not obvious, whereas I don't like some patients, if you're putting in lozenges or gum throughout the day, they might not be comfortable doing that in front of others. And you can use it with other nicotine replacement therapies as well.
What are the risks and benefits?
So some of the risks include well, I guess not really a risk, but more of a side effect could include insomnia, so kind of difficulty sleeping because of the nicotine. However, if you do experience this, you can take the patch off before bed. There are also a couple drug interactions, including like adenosine, cimetidine, and varenicline. So if you're on any of those, we'll probably go with a different option. And some patients, if you have sensitive skin, you might have a slight reaction to the adhesive. And then on top of the insomnia, some patients also report vivid dreams as well.
Are there any reasons that I wouldn't be able to take this patch?
There are a couple. So since it's stimulating your nicotinic receptors, if you've had an MI in the past 2 weeks, we're going to want to avoid that. Or if you have any serious underlying arrhythmias or angina, and as well as pregnancy, breastfeeding, and adolescence, which are similar to Chantix.
And how much does the Nicoderm patch cost?
So this is going to be a cheaper method than the Chantix. It's only going to be about $2 a day.
Oh, that's pretty cheap. Okay, well, thank you so much. This
Yes.
information was very helpful.
Okay.